Hi, it's me, Dr. Ivie Okundaye Appiah. I'm coming to you back with more news and more analysis with everything that's going on from a public health standpoint. Okay, so let's jump right into it. African Americans are at increased risk for this virus. Very interesting. So, initially, on social media, there was some concern that, hey, you know what? African Americans are less likely to get it. This is not an issue that we have to deal with. No, that is not the case. That is not the case. And now that we've collected a lot more data over the last several weeks, what's actually been found is that African Americans represent the majority of deaths, actually related to coronavirus. In particular, CBS News and Chicago Tribune reported that in Chicago, approximately 70% of COVID related deaths were among African Americans. Um, in particular, there were 98 deaths, 67 of those deaths so far have been among African Americans. And it's so interesting because there could be multiple explanations as to why this is. First, let me say that in Chicago, African Americans represent approximately 30% of the population. So the issue is that there's overrepresentation. And so this is an example of health disparities. Okay, and there could be multiple reasons for this. The biggest one is the fact that African American populations tend to have heart disease, diabetes, pulmonary disease, or lung disease. And these are things that increase your risk for death. Now, the mechanism of death, unfortunately, is oftentimes related to heart problems or lung problems. Um, and this is something that's commonly seen in these populations, in the general population, but disproportionately so African Americans. Okay, now my other concern is that perhaps that African Americans may still be working. They may be part of the workforce for people who have essential or who considered essential services. And so there could be multiple reasons as to why that's taking place. Now, this issue is not related to just Chicago, it's happening all over the country where there may be more dense populations. So, this is something we really have to follow closely and see, how can we do, what can we do, how can we help? Now, I know there have been some discussions about maybe more targeted approaches, perhaps, for example, in Detroit, going to maybe low socioeconomic status communities or oftentimes African American communities and having specific outreach health programs. Perhaps there's going to be always increased risk with that for those workers who would be deployed there. I think that's a possibility. But this speaks to the larger issue of health disparities in general. So, coronavirus is not the first time we're seeing this. All across the board, in healthcare, there are differences in Caucasian populations versus other populations, Hispanic, African American, Asian populations have their own specific issues. Certainly, Native Americans are an at risk community because of the beleaguered history we have in this country. And so I think this speaks to the larger issue of what else we can do as a systemic issue. Of course, access is going to be a large part of that. I do believe that more people of color, women of color, should be physicians, should be nurses, and providing care so that we can try and bridge that gap and increase access. It's a complicated issue. What do you guys think? I think, Dr. Patrice Harris of the American Medical Association, I think she's doing a great job and doing amazing leadership with her organization. Even the Surgeon General, Mr. Jerome or Dr. Jerome Adams, also another African American gentleman, they are, I think, doing a great job to try and share what's going on and illuminate this larger issue. So tell me what you think. Are there ways we can improve? We'll talk to you soon. Bye.